So welcome. Thank you all very much for joining us this evening. My name is Jessica O'Connor, and I'm a consultant on the workforce development team within Dartmouth Health. And tonight we're going to be talking to you about the Dartmouth Hitchcock Medical Center APP postgraduate programs. So let me get to my screens and I will start. All right, so this evening, what we're going to talk to you a little bit about is we'll share with you talking to you about what it's like to work as an advanced practice provider within Dartmouth Hitchcock. We have our amazing director of our APP postgraduate programs. We have several of them who are here this evening. And we also are going to tell you a little bit about why you might want to consider doing a postgraduate program versus jumping right into work. After we have the opportunity to share that, we'll go into a little bit of detail around each of our programs that we have. We have 6 programs here within Dartmouth Hitchcock Medical Center for postgraduate APPs. Those include our hospice and palliative medicine, our hospital medicine, our otolaryngology ENT surgical residency, neurology, critical care, and cardiothoracic surgical residency. So after we do that high-level overview of each individual program, we then are going to share with you the important next steps. So hopefully you're going to get very excited about one or multiple of the opportunities and think, all right, how do I join that great team? How do I learn from the team within DH? And how do I help move forward my career? So we will talk to you about what those next steps are if you are interested in applying to our programs, and then have an opportunity for any questions that you might have. So without further ado, what we are going to do is I'm going to introduce you to, you'll see here on the screen, our program directors. Now, not all of our program directors are able to be here with us tonight, but on the last slide, I will provide you contact information, and you will also have the opportunity to reach out and ask any further questions of them. So here we have Jillian Belmont and Jason Johns, who are the co-program directors in neurology. We have up top Amelia Kerner, who is the program director of critical care. On the bottom left, we have Lisa Stevens, who is here this evening with us, who is the program director of hospice and palliative medicine. We have Austin Holt, who is the program director of the cardiothoracic surgical residency. And then we have Cindy Dunn, who is here with us this evening and who's going to be speaking about the hospital medicine fellowship program. And we also have Matt McCabe, who might be joining us this evening to talk a little bit about the otolaryngology surgical residency program. And before we do that, before we talk about each of the programs, it is my honor to introduce you to Cheryl Alinsky. Cheryl Alinsky is the director of the Center within the Center of Professional Development and the newly created Office of Advanced Practice Providers. We recognize at Dartmouth Health the importance of advanced practice providers in providing excellent care, and this newly formed office is just a testament to the commitment that the organization has. And Cheryl is leading this great team, and I'm happy to introduce Cheryl to talk a little bit about the programs and why you might consider joining a residency or fellowship program with us.
Great. Thank you so much, Jessica. It's a pleasure to be here and an honor to be here tonight. And full disclosure, I have not stood up a program, and I'm not a program director. But I was, I'm so grateful that and honored that I was chosen to be the Director of Continuing Professional Development and Education within our Office of Advanced Practice Providers. So we have a Chief APP Officer, and then we have my position, which spans many things from students to onboarding and education opportunities for staff APPs, but also facilitating monthly conversations with our program directors and how can we all work together to, have the best possible APP postgraduate programs at DH, Dartmouth Health. A little bit more background. We have one main campus, the Academic Medical Center, which where we have approximately 600, between 600 and 650 APPs just on our main campus. And that's the picture that Jessica had up in one of the initial slides. We have multiple sites that we're closely affiliated with, and one as far as approximately 100 miles away, others in our backyard. So we have a huge catchment area, and we have many affiliates, and altogether we probably have 1,000 APPs in all disciplines. We're closely affiliated with the Geisel School of Medicine at Dartmouth College, and there are 94 medical students per year that we also cross paths with, and there are many physician residencies and fellowship programs that we also cross paths with. What else can I say? I can say that we're building community in our APP organization with APP Week. That was a very active week this past year, and we have meetups, quarterly meetups, and we also have a CME that I facilitate twice a month. We have a program for APPs, mostly given by APPs, and that's a twice per month CME in all ranges of medical topics. And I know that the program directors are very committed to having their residents and fellows attend this CME. So, for example, this coming Tuesday, we'll have a talk on inflammatory bowel disease. The first 3 talks in the first of the year will be on AKI, CKD, and nephrotoxic agents. And that's just gives you a little bit of a flavor. We had our first annual APP conference this past fall, and that was delivered by approximately 25 APPs. Lisa Stevens, who's on the call tonight, participated in that, as did Amelia Kerner, who is, as you saw, the program director for critical care. Jillian Belmont, the co-program director for neurology, participated. So it was a really wonderful conference, and that will continue every fall. This fall, we're looking forward to a pediatric conference. And again, we meet the program directors. I meet with them on a monthly basis. And for example, we just met yesterday, and we had a wonderful discussion about core topics that we want all of the programs to teach and participate in. And those topics include cultural competencies, transgender medicine, topics along the lines of debriefing, difficult conversations, crucial conversations, things along those lines that we want, again, every fellow and resident to be exposed to during their time with us. One last thing, similar to many other programs across the country, we're at this point in time, we're using residency and fellowships, both. And that is a little bit of there's a bit of a historical component to that. So CT surgery and critical care, and now ENT, are CT surgery and critical care are accredited by ARC-PA, and ENT just went forward with their application and site visit this past week with ARC-PA. We are going forward with applying for, and Lisa Stevens can expand upon this, neurology and palliative medicine will be applying for APFA fellowship, and they are currently calling their programs fellowships. So bear with us. I think we're not alone in this, that we have fellowships and residencies. The APFA program, if you all are familiar with that will dual accredit a PA and an NP. One last thing is that, I've had a very unique vantage point. I've taught for years at our local PA program, and I can see firsthand what PA students are exposed to in the classroom. I've been a preceptor, so I can see firsthand what PA students may or may not be exposed to in their clinical year. And that may set people up for a really challenging first years of practice. There are some, with strong onboarding programs, one can be set up for success. But I think that literature very much supports postgraduate programs, be it residency or fellowships, for real specific, detailed, elaborate, elegant further knowledge in specific areas. And with that, I will pass it on. Happy to answer questions at the end.
Thank you so much, Cheryl. Thank you not only for speaking about the opportunities within Dartmouth Health, the continuation of the Office of APP, but also for your experience and leading this incredible program and opportunities for people to come and learn. All right, so let's dive into the specific programs. So first up, we will talk about hospice and palliative medicine. And I'm going to invite to the virtual screen Lisa Stevens to talk a little bit about the program.
Hi, everyone. Just to give you a little background about me, I've been at Dartmouth Health for 20 years. It's a great place to work and a great place to learn. It's always been my dream job. And there's always, bumps in the road from time to time, but it remains my dream job. And so I hope that you really take a serious look at our institution. So our Hospice and Palliative Medicine Fellowship, initial fellowship with physicians through ACGME started back in 2009, and I was lucky enough to help with writing the PIF for that and being part of the education process all along. And then we're into graduating our sixth nurse practitioner fellows in July, and so in 2020 we graduated our first class of they were APRN fellows at the time, and so we have funding for 2 fellows each year, and it is a 1-year clinical immersion experience. And during that time, APPs have the opportunity to work collaboratively and go along their fellowship with 3 other physician fellows. And so we have, we call it an interprofessional team and an interprofessional fellowship. So APPs get a chance to learn along with the physicians, and they do all of the same clinical rotations. Some of the blocks are a little different because of requirements through ACGME, but the majority of the blocks are all pretty equivalent. We also have been collaborating with a regional network of HPM fellows from UVM and Maine Medicine and Androscoggin up in Maine. And this past time we had a retreat. Our first annual retreat was done in July, and it was kind of a boot camp for our fellows, and they learned communication and responding to emotion and basics of pain management and symptom management. And then we just had another one up at UVM, and that was a little bit more of a higher skills of family meetings and dealing with, multiple family members and complex care. Additionally, the faculty is diverse and just as interprofessional. We have nurses, physicians, researchers, social workers, and all of them work on the palliative care team and help to educate our fellows going forward. Healing arts, we have a pharmacist. It's a wonderful opportunity. We do have an innovative curriculum. We really rely heavily on Vital Talk, as well as the serious illness conversation through Atul Gawande's group at Ariadne Labs. A lot of our faculty are also Vital Talk trained and have done faculty development. Clinical rotations, and lots of clinical and professional growth areas. We have an expert on our clinical team that is a national expert in substance use disorder and concomitant serious illness. Our team meets daily. There's a lot of wonderful opportunities for learning throughout the week. Learning blocks include inpatient consultation and ICU consultation. We do 4 weeks of home hospice with one of our area home hospice programs, Bayada. with one of the APPs who is the faculty there, has graduated our program. We have inpatient hospice at our Jack Burns Center for Palliative and Hospice Care, and you get a lot of time learning how to care for patients at the very end of life and really robust symptom management skills. We do have a long-term care rotation as well at our area nursing homes with our geriatrics team, and also 2 weeks at Kendall, which is a continuous care community. There's a spirituality block, a pain medicine block, heart failure block as well with our APPs in our heart failure program, and 2 weeks of social work. Our educational experience includes core didactics. Every Wednesday is Didactic Wednesday afternoon. There's weekly educational conferences, communication sessions that are really just with the fellows, and we also use standardized patients as well during those sessions. We have narrative medicine that's taught by several of our faculty, culminating in you learning how to also lead a narrative medicine group. On Wednesdays, we have something called Wisdom Wednesdays, and it's an opportunity for everyone to talk together about a case that they've experienced with a complex communication issue. We learn new techniques and new approaches, and we talk about the differential diagnosis of why the patient responded in the way that they did and how it made us feel. And then there's Treatment Challenge Tuesdays, where we always kind of talk about complex cases. Medications for substance use disorder is also a big part of our team, where you can learn that in clinic. There's academic time, and we have a longitudinal continuity clinic as well. And all of us our mission on the palliative care team is to really focus on education. That's our primary goal. And so we're so excited when we get new fellows, and everybody is very committed to the educational process there. Thank you.
Wonderful. Thank you so much, Lisa. And as I mentioned earlier, we're going to be showing all of the application deadlines. If you are interested in one specific program, we'll share all of that next steps at the end. And next program that we have up, I'd like to invite to the virtual stage Cindy Dunn to talk about our Hospital Medicine Fellowship, one of our newer fellowship programs.
Oh, and Jessica, we might be extending our deadline, so make sure you mention that. I might be stepping off, everyone, and so if you have any questions about the Hospice and Palliative Medicine Fellowship, please write to Jessica, and she will get you my contact information. I'm happy to talk to anyone. Unfortunately, I do need to step off. I had some dental work today, so thank you.
Thank you so much, Lisa.
Hi, everyone. I'm Cindy Dunn. I am in hospital medicine, and I started at Dartmouth 2.5 years ago. I moved up from Boston, where I'd been a bedside nurse and then working in large urgent care centers. And I'm so happy that we moved up here. I wanted to get back into an inpatient acute care environment, and the department I work for is just fantastic. Everyone there is so supportive. It's a really large department, and everyone there just wants to teach, and they're so nice, and it's just a really cohesive team of docs and APPs. We kind of try to integrate our fellows within that team as seamlessly as we can. So about our fellowship, we are pretty new. We just started our second class. Nicole started in October, and she'll finish a year from then. And Sarah and Anna were with us last year, and Sarah actually stayed on with our team and started in October as well as a full member of the team. And we're so grateful for her staying on, and Anna's actually still within the Dartmouth Health organization. She just stayed on closer to where she lives in the southern part of the state. So our fellowship is still a little bit of a work in progress, but we have 2 independently run APP teams at Dartmouth within hospital medicine, and the fellow basically is seen as a learner on the APP teams within hospital medicine, and our really focus is the ultimate generalist, right? We have to know a lot about a lot, and we have to know when to tag in other specialties where it's kind of outside of what we know, and ask for help. So our fellowship is within, like I said, the kind of really large collaborative hospital medicine department, and our patient population is kind of runs the gamut from anywhere 18 and up. They're generally very medically complex and acutely ill. Oftentimes they decompensate at the bedside over the course of their stay for one reason or another. And we work with specialties throughout the hospital: interventional radiology, neuroradiology, orthopedics, trauma, critical care, nephrology, infectious disease, palliative care. We kind of work with all of the specialties, and I think of us as we kind of are like the primary care of the inpatient world, and our job is to kind of line all those ducks up and keep the patient at the center and kind of guide their care based on all the specialty recommendations, but also keeping the big picture in mind. So our fellowship has rotations with these specialties because it is really important to know kind of what those specialties think about and how they function as you think about your patients. So we have infectious disease, PAL care, IR, emergency department, infectious disease, nephrology, and diabetes lined up for this year. We also will potentially do a longer rotation with critical care at the end of the year. And the final month of the program, our fellows do a month at our partner hospital, which is in Lebanon. It's a small critical access hospital, to really kind of put everything that they've learned over the last year and get the experience of really functioning fully independently at a smaller, slightly less acute hospital, and use that opportunity to kind of hone their skills over their final month. Our fellows work throughout the year on gaining exposure and experience with note writing. You're responsible for your patients, so you write daily progress notes, you do discharges. If you have an admission, you write the H&P. You compile differential diagnoses, you initiate ICU transfers, you take people out of the ICU if they're stable to come out. We work on EKG interpretation and radiology interpretation, and we're also working on getting more time in the anatomy lab and some sim lab courses up and running. We also do the serious illness conversation that Lisa was talking about, where you kind of get exposure to having these difficult conversations with patients and their families. And you can get CME for that as well. It's a really great course. We expect our fellows to round with their attending or APP that they're with that week. And that's really to allow for what we call spot learning. So kind of outside the room, I have a question about this lab, or what's my plan for the day, and why am I going to be doing this one thing? Kind of gives you that opportunity to learn while you're thinking about it, instead of trying to remember on your ongoing list of things to do, something that you need to do later in the day. We have weekly conferences that we expect our fellows to go to, like the morbidity and mortality, the conferences that Cheryl is running. And then we're working on combining conferences and lecture opportunities with the other fellowships in the hospital to try to not reinvent the wheel for everybody. I think that's kind of it. I hope if you have any questions, we'd love to have you. We're really hoping to continue to grow our program. I'm hoping to get us ready to go for accreditation sometime in the next year. And it's a great team, and it's really, really interesting work. And I think it's a really, really great place to start your career from as a new grad. I wish I had that opportunity as a new grad.
Perfect. Thank you so much, Cindy. And we also have curriculum and much more in-depth information on our website, which I will put in the chat as well. And so that you can look up a little bit more about each of those programs and the contact information if you have specific questions. So next, I would like to move to our otolaryngology surgical residency. And to start our conversation, I'd like to invite Matt McCabe to speak about the program.
Thanks, Jessica. Good evening, everybody. My name is Matt McCabe. I am the program director for the ENT surgical postgraduate residency. Program is in its fifth year now, sixth year, going on sixth year, started in 2017. We typically will have 2 spots for residencies with a staggered start. So one starts in the spring, one starts in the fall. The goal of the program is to make sure that our students, or our residents, I should say, get experience in kind of all different areas within the hospital, within ENT specialty. So we make sure that you have experience in the operating room, being a first or second assist, managing the inpatient, kind of the perioperative patients after they have surgery, on the inpatient side of things, and then make sure that you're getting a lot of experience in the ambulatory outpatient clinic. The curriculum is really based off of the surgical resident schedule. So you're each and every day you work right with the ENT surgical residents. There's 5 of the ENT surgical residents. You're expected to go to all of their planning meetings, all of their didactic sessions, all of the morbidity and mortality conferences, journal club. You're expected to present monthly in that. And then we also try to make sure that you're getting a kind of a well-rounded medical education as well. So you meet with radiology, we have pathology conferences monthly. You work with plastic surgery, oral maxillofacial surgery. We also tried to set up some observation time working with audiology, physical therapy, things like that. So it's been a really good experience. I've been the program director for about a year and a half now. Like Cheryl said, we just got done going through accreditation. So excuse me if I look very sleepy. I'm still catching up from sleep from all that. And I'm a graduate of the program myself, so I'm very familiar with kind of the ins and outs. So really excited for this. Hope somebody's interested. If anybody has any more questions, I'm very happy to kind of sit down and talk more with you about it. Thank you.
Excellent. Thank you so much, Matt. And hearing Matt and some of his team talk, it's just really incredible the innovation that goes on and the diversity in skills and competencies that you learn. So thank you so much for sharing your enthusiasm for the field and ENT as well. All right. So next, I'm going to hand the baton back to Cheryl, who is going to be speaking about our next 3 programs. Our program directors for neurology, critical care, and cardiothoracic really send their warmest wishes this evening due to a variety of conflicts, being kiddo holiday concerts to needing to be in the operating room. We were unfortunately not able to have all 3 of them join us, but Cheryl will lead you through those next 3 programs, and then we'll open up for questions and also talk about timelines for which programs we have and what those next steps are.
Great. Thank you, Jess. I work really closely and have for years. I also have been at DH for a long time. It'll be 17 years in February, and I'm thrilled to still be at Dartmouth. I've worked very closely with the 2 co-program directors, Jason John, PA, and Jillian Belmont, APRN, and really getting to know their program over the past year. I think they are at least 2 years into their program. They're not accredited yet, but they're up for going through the accreditation process again through APFA. And they have as their premise that a fellow will be exposed to all of the neurology subspecialties. It is a very large group, neurology, of physicians as well as numerous APPs. It might be one of the larger APP departments in the hospital. There will be a mix of acute care, inpatient, and ambulatory settings in terms of exposure, and a goal being to develop critical and highly marketable ambulatory, inpatient, and neurocritical care skills, and then to be skilled and knowledgeable as a neurology APP. The core rotations are general neuro, movement disorders, neuroimmunology, fascinating, stroke, cognitive behavioral, neurophys, headache, epilepsy, and neuromuscular. And again, they have numerous APPs that are subspecializing in these areas. They have a very strong didactic curriculum, and they also interact with a physician fellowship and residency program. So their lectureship series is very robust. And they also do interdisciplinary case discussions, numerous rounds, whether it's neurology grand rounds, surgical grand rounds, and then they also have journal club and self-learning modules. Jillian is our Board of Governors APP representative. She's very active at the state and national level, and she's also very actively involved in research. Here you can see at the bottom of the screen our two 2022 fellows, and Leah, who was a fellow and then was hired into the neurology department. Please, if you are interested in this program or any of the programs, there will be contact information where you can speak directly with Jillian or Jason in this case. And then the critical care residency. So this is one of the programs that is ARC-PA accredited. They were one of our first programs. And if you are drawn, as it says, to team-based care, this is your place. If you enjoy anatomy and physiology, this is your place. If you seek the privilege of caring for and supporting patients and their families in times of crisis, critical care is for you. They were very, very actively involved in COVID. This group, the APP group, and including their residents, really ran the COVID ICU in the peak of the pandemic. Their goal is to prepare clinically outstanding APPs who are ready to practice critical care medicine as members of a multidisciplinary team with a high degree of professionalism, competency, and curiosity. I've known Amelia Kerner, their program director, for years, and I can't say enough about her. This is true and true, what I just read from what she has written. They provide a diverse and hands-on critical education that fosters critical thinking, leadership, and lifelong learning. Their core rotations include the medical ICU, the surgical ICU, the neuro critical care unit, and the cardiovascular critical care area. They have skills where they want to see perfection in airway, interventional radiology, and palliative care, and then they have elective blocks. Didactics are also strong and robust in this area, and they include many of the critical care physician residents and fellows also. It's a systems-based curriculum. There's one protected didactic day per week, and they have a really nice hybrid remote and in-person learning curriculum. And then our last program, which I believe is our oldest program, it is also ARC-PA accredited, and this is Austin Holt. And Emily and Austin and Jason and Jillian were very sorry to miss out on this opportunity. Like Jessica said, there were many conflicting, things going on, including their children's performances tonight. So in this CT surgery residency program, you gain valuable first and second assist surgical experience in a variety of open, endoscopic, and robotic procedures. It is very high procedure based. Develop critical and highly marketable operating inpatient ICU and floor outpatient clinical skills. There are weekly lectures, imaging, as you can imagine, grand rounds, M&M or MM&I, anatomy lectures, and tumor board conferences. There are the rotations, as you can see below, many open heart surgeries, which include surgeons and the surgical PA group. And their patient population is adult only, and they are active in the pre, intra, and post-operative care worlds with outpatient, inpatient, and OR experience. So that's the cardiac rotation. And then for thoracic, that includes robotic VATs and open cases, again, surgeons, surgical PAs, and also this does include teens as well as the adults, and same, there's pre, intra, and post-operative, outpatient, inpatient, and OR experience. So very robust department at DH, that is cardiothoracic surgery, and it would be a thrill to be a part of that if this is an interest of yours. And Jessica, back to you.
Absolutely. One of the exciting things also, along with Matt, who had mentioned that he himself, before being a program director, was a resident. Our current program director, Austin, is now, he was a resident as well. And also his co-resident, who started in 2016, is also still here. Jonathan is working on the thoracic side. So it's really exciting to see the growth opportunities for our residents and fellows. You've heard several examples of people staying on. We also have a lot of people who have taken the knowledge of their residency or fellowship out into their specialty throughout the United States and really carried that learning through and become experts in their field, and taken that from the academic medical center to smaller areas to throughout the country. So it's just a really exciting opportunity. So hopefully we have given you just a taste of what our programs are like. And I'm hopeful that you will be inspired to look further, dive into the website, reaching out, asking some questions, and submitting an application for one of our programs. As you'll see here on the screen, we have our two programs that are coming up with a sooner deadline, and those are hospice and palliative medicine and neurology, which are going to be having application deadlines within the next month or so. So please note that if you are interested in hospice and palliative medicine, there is a potential that we might be extending the due date to the first week of January. So just so you know, don't let the tomorrow deadline deter you if that is something that you are looking for and have a real interest in. So you'll see neurology deadline is January 15th, cardiothoracic is February 5th, hospital medicine will be in the spring of 2023, critical care is February 19th, and as Matt mentioned, in ENT, we have a spring start, which we're already filled, and we are looking to fill our fall start. So we have a rolling application process for the fall. So these are our information dates. We do have some of our programs have specific webinars or Q&A sessions that dive a lot deeper into their programs. And these are actually two of our bigger programs and our longest run, which is the cardiothoracic surgical residency as well as the critical care. So we urge you, if you have any interest to join one of those, to please reach out to make sure that you sign up for those, where they will be very specific on what those programs entail, some of the didactic, the learning experiences. So If you have questions, we will leave a few minutes now to answer any questions that you might have. But I also wanted you to take a note of our program's email addresses. If you have any questions at all, you can send an email to any of these following ones here. You also can just reply to this message here. You can send an email to myself. You also can use the QR code at the top of the screen, and that will take you directly to our website. Cheryl.
Thanks, Jess. I didn't mean to interrupt, but I also want to just emphasize that we have a lot of support from both the Office of APP and where that sits, which is the Center for Learning and Professional Development. So the support that these programs have is broad and deep. We also have an accreditation coordinator, Chris Dyke, who is on the call. And Chris has not only gotten to know each program, how it runs, how the data is collected and stored for each resident, fellow, faculty, their curriculum. She also really gets to know the residents and fellows and is a really strong link between the residents and fellows and the Office of APP. Really gets to know from, a half a step away. She's not an APP and she's not a program director, but her position is just so valuable in bridging a gap between a fellow resident and their program, the Office of APP, and the institution at large. So I wanted to let you know about that, and also that we're so grateful that we work so closely with Workforce Development, Jessica's team, because they also really help us with breadth and depth of all kinds of activities related to running a really successful program.
Thank you, Cheryl. We had a great question in the chat asking about how many positions. So the majority of, I think almost all of our programs typically hire for 2 residents or fellows per cycle. Some of those, as Matt mentioned, that might have a staggered start, but typically they are 2 people and we try to start them together if we can. Specifically, the question was around the cardiothoracic, which we do have 2, and that's a typical fall start is what we look for in cardiothoracic. And what we do is it's always wonderful when we can hire a past or a current resident or fellow directly into employment. And we even have additional sign-on opportunity bonus for people who stay on afterwards. So it's something that one of the things that we also try to work closely with our talent acquisition partners is usually around the midpoint of someone's residency or fellowship. Our talent acquisition team will reach out to each and every one of the fellows and start having that conversation of what's next. Are you someone that is looking to work and stay within our Dartmouth health system? Are you interested in staying in New Hampshire in the Upper Valley? And let's talk about what the current and projected opportunities are once you finish your 1-year program. Or are you someone who is looking to bring that knowledge back home, and how can we help support you on that journey? So we have that built into the program as well, because one of the things that we want each and every one of the residents and fellows is to really grow themselves, not only technically in their specialty, but also from a professional level. We want you to have that knowledge and that skill and the support to stay with us, which we love. And also, if that's not your choice, then we also want to help support you on whatever that journey looks like for you. Are there other questions that people have? Feel free to write them in the chat. You're welcome to unmute yourself. You can ask. We have Matt and Cindy and Cheryl here who can speak to any of the curriculum, the programs. Happy to talk about timing or any other questions that you have logistically.
Hi, I have a question. Thank you for this information session, by the way. I have a few questions. The first one is, can I apply to more than one program?
You sure can.
Okay. Because I already submitted my application for the hospital medicine, But I was also interested in neurology. So
Absolutely.
okay.
And what I would encourage you to do is get to talk with the teams, talk with the program directors, and find out what really strikes your passion, what's something that you're really excited and interested about. So go through the process for sure and learn about them both or all.
Mm-hmm. And I was wondering, what are the fellowship training schedules are like? I'm pretty sure it's different by program, but is it like Monday to Friday, like 8 to 5, 9 to 5, or is it like 12-hour shift, 3 days a week? I was just, curious about it.
Each program's a little different based on the patient population, the time, and where the didactics and the lessons happen. But Cindy, you can definitely answer from the hospital medicine side.
Yeah, for sure. So we try to keep it mostly during the weekdays, just because you're going to have your whole career to work weekends, and we want to optimize the learning opportunities that are available on the weekdays. That said, we do want our fellows to work some weekends, and we pick and choose which ones those are based on who you're working with, just to get that experience of things that can and can't happen over the weekend, and the different pace of the hospital, and what happens if something happens to a patient over the weekend. Our fellows they work basically 8 12-hour shifts in a 2-week pay period. And they have a protected didactic day, which right now is Tuesdays. But they are, except when they're on rotations, they're doing 12-hour shifts. So I tell them to expect to work at least 40 hours a week, every week, more like 50 most weeks. There is wiggle room. We are flexible. We do want to value and respect people's work-life balance, but also acknowledging that you're making a commitment to be here for an intensive year. So most weeks we expect it to be a pretty heavy week, but you do get most of your weekends.
Sorry, Cynthia, you said 8 12-hour shifts in how many weeks?
In 2 weeks.
In 2 weeks.
So about 4 a week.
Okay, gotcha. 4 a week. And do you know how a neurology one is like?
I don't know what neurology is. I don't know if Jessica or Cheryl do.
Okay.
Cheryl, I'm looking your way because that one I am not as familiar with the schedule.
Sure. Because there are inpatient and outpatient rotations, the schedule will vary for inpatient shift work and outpatient hours. But those are the specifics. I think if you were to contact Jason Johns or Jillian Belmont, or through their website, they would really be able to give you specifics.
So you can you'll see the email on the screen. So neuroscienceapp@hitchcock.org is where I also wrote that down, so I can make sure to follow up to find that out.
Mm-hmm. Oh, my last question is, do you guys give any sick days or any vacation days, in case we have like emergency?
Yes, our residents and fellows are hired as full-time employees, so they are benefited, and we can send also the information on what the benefits look like for individuals who are coming in through the programs. But that also does include earned time. It includes which is sick or vacation days as part of that benefit package.
Okay, thank you.
Great questions. All right. Well, if you have other questions, you are welcome to send an email to any of the emails on the screen. You also may reach out directly to me, and I'm happy to answer what I can and also share with our program directors if there are things that go a little bit deeper than my knowledge. So again, thank you so much for joining us this evening and taking the time out of your day to learn about our opportunities within Dartmouth Hitchcock Medical Center APP programs. And we wish you the best on your application process, your exploration of postgraduate programs and positions. So thank you so much. We hope that you have a wonderful holiday season and appreciate you being with us this evening.